monthly networking webinar, Putting the Plan into Action, how we can put the Wisconsin Cancer Plan 2020-2030 into action. As a reminder, we have monthly networking webinars. They occur every second Thursday of each month from 10 to 11 a.m. A complete list of upcoming webinars and previous webinar recordings are available at the link that you see on your screen. I would like to mention as well that we will be soliciting your feedback in the coming months on how the networking webinars are serving your needs. So be on the lookout for various questions that we might be asking you either during the webinars or immediately afterwards to assess how we're doing and hopefully incorporate that in the 2021 monthly networking series webinar. I also would recommend that if you have any networking webinar ideas for presenters or topics or things that you could find helpful, or maybe any presenters that you've found to be really inspiring or informative in this virtual world that we're living in right now, feel free to recommend them. We are always welcome and excited to get your input and ideas. So I would first like to introduce myself and my co-presenter for today's webinar. I am Sarah Kirch, and I am the director of the Wisconsin Cancer Collaborative, and I will be joined with my colleague Beth Brenner, partnership manager for the Wisconsin Cancer Collaborative, who joined us in March of this year. And as a reminder, the Wisconsin Cancer Collaborative is our statewide coalition comprised of approximately 140 organizations, all working together to reduce the burden of cancer for everyone in Wisconsin. We connect our members with the tools, support, and knowledge they need to create healthier communities. So today's agenda includes a really high-level overview of the Wisconsin Cancer Plan 2020-2030. I know many of you have already opened the Wisconsin Cancer Plan or looked online, so we're not going to go into too much detail, but what we will talk at great length about is our approaches to take action and reviewing the measures and steering committee input that they provided in September on how we can possibly narrow the Wisconsin Cancer Plan 2020-2030 into approximately 2 to 3 action areas where we really feel like we need to work together on. We will have discussion throughout that Beth will facilitate for us. So get ready to unmute your lines and get your fingers warmed up to chat in the chat box, and we will make sure that we have a robust discussion, hopefully throughout, and if we need to, we can have a lengthier discussion at the end as well in response to poll questions that will be asked of all of you to help us further narrow the Wisconsin Cancer Plan. So as a reminder, the Wisconsin Cancer Plan was released in August of 2020. It's available at our website on wicancer.org. There's both an online interactive version and a PDF version. The PDF version is in print form because of limited opportunity to see all of you in person. We will be mailing those actually out to all of the summit participants. So hopefully you all were able to register for our summit, which is occurring later this month, and a reminder will be placed at the end of this webinar as well. But if you did register, you'll be receiving a cancer plan in the mail, and also we'll be sure to have ample Wisconsin Cancer Plan print versions at various upcoming and hopefully soon in-person meetings where we see all of your lovely faces again. But in the meantime, it is available online, and the online interactive version actually includes a few more pieces that are pretty important that might be helpful for you all to get started on taking action as well. And those include the action steps, which are more granular activities to take action on the Wisconsin Cancer Plan. It also includes data measures with data visualizations to track our progress over time. And then also resources to take action, because we know sometimes opening up a strategic plan like this and how to get started, it can be quite overwhelming. So we're trying our best to make sure that any resources available on our website can help answer those questions on how possibly to take action. The vision of the State Cancer Plan is a healthier Wisconsin by reducing the burden of cancer for everyone. And our mission is to engage diverse partners to develop, promote, and implement a statewide comprehensive approach to cancer control. The overarching goals, there are 6 overarching goals of our Wisconsin Cancer Plan that include advance health equity as it relates to cancer, reduce the risk of developing cancer, detect cancer at the earliest stage possible, reduce death and suffering from cancer, improve the quality of life for cancer survivors, and finally, improve the quality and use of cancer-related data. These 6 overarching goals were instrumental in helping us identify the 7 chapters of the Wisconsin Cancer Plan. The Wisconsin Cancer Plan chapters, I like to say, have 2 important bookends: health equity as chapter number 1 and chapter 7, data. And that encompasses the cancer care continuum from risk reduction, early detection and screening, treatment, survivorship, and end of life. So I'd like to take a moment to talk and provide a brief overview of the approaches that we plan to take action on and why you're all on today's call. Action areas. Action areas are approximately 2 to 3 action areas from the Wisconsin Cancer Plan. They are led, the development is led by our steering committee, or our group of approximately 20 people around the state serving in an advisory capacity to help guide the development and implementation of the Wisconsin Cancer Plan. And ultimately, they're chosen, though, by you. That's why you're on the line today, and you might be hearing from us in various emails in the next few months and in the summit to really get your input on where we need to take action in the cancer plan. And they're implemented by the membership in 2021 and 2022. We know that if implementing the state cancer plan was really just up to the staff of the Wisconsin Cancer Collaborative, we would get nowhere fast. And it really relies on all of us coming together to take action on the highest need areas of our state. But there's also a policy agenda that we use as an approach to take action as well. And that is developed, the development is led by our policy committee. It's ultimately approved by our steering committee, and it includes important action area policy issues. So there's an overlap where we recognize some of the action areas that you'll all be discussing today have important policy action areas as well. Those are then incorporated in our policy agenda as well as in addition to other timely policy issues from the Wisconsin Cancer Plan. Just like our action areas, the policy agenda is implemented by the Wisconsin Cancer Collaborative membership, and it'll be implemented in 2021 and 2022. So why select action areas? Well, the Wisconsin Cancer Plan strives to include everything that's needed to completely and effectively address the cancer burden in Wisconsin. But we know resources are limited, resources in time, funding, capacity, you name it. If we could multiply ourselves, I think we would do it in a time like this. But unfortunately, we don't have that opportunity. And so action areas can help us prioritize what the Wisconsin Cancer Collaborative membership believes are the most important efforts for our coalition. So here are some important questions that we ask ourselves when thinking and considering what action areas could be focused on. Is this a specific area that we need to work on together? If we work on this separately, will we not get as far? Do we really need to put our efforts together and collaborate and partner on this in order to really make a meaningful change? Is this a significant area of need? Does it have a reasonable chance for success? You know, being a smart objective, the R in that is being realistic and making sure that we're setting ourselves up for success. And so we want to make sure that that is to be considered as well. Can we track progress and outcomes? And is it likely that we'll be able to recruit other individuals and organizations to work on this over the next year? We know that even the people on this call or the people in organizations that are part of the Wisconsin Cancer Collaborative are not the only people that need to work on this as well. Can we easily, as a coalition, recruit individuals in organizations that are not active members to be active and to engage with us on these important topics, both at the state, regional, and local level? And ultimately, this is one question that I often ask myself, and probably you've all heard in time as well, is if the Wisconsin Cancer Collaborative members did not take a lead on this, would anyone else? And if the answer is no, there's likely an opportunity and need to lead this effort. And I put an important asterisk behind this because us taking the lead on an effort and us selecting an action area and taking the lead on that does not mean, though, that we would stop being at least supportive of partner-led initiatives. So we know that there are robust programs and initiatives already occurring in the state that we wouldn't necessarily need to reinvent the wheel or take the lead on, but we will still obviously maintain support, especially if it's in the Wisconsin Cancer Plan. So I wanted to put that important asterisk there. We're really talking about things that we need as a membership of our state's Cancer Coalition to take the lead on. So with that introduction, I wanted to just highlight today's remaining tasks. So we will review, and Beth will lead this next venture for us. We'll review the summary of measures by chapter, and as well highlight the input from the steering committee that was discussed at length in their meeting earlier in September. We'll hopefully have time for a discussion by chapter. So again, that's why we hope your fingers are warmed up for a chat and your fingers are hovered over the mute and unmute button. Because we ultimately want you to make your selection. So we'll ask you via a poll to further narrow the steering committee selection to 2 to 3 areas. So hang on tight, and hopefully you will all be able to participate in the remainder of today's call. So without further ado, I will pass over the mic to Beth Brenner, our partnership manager, to talk about our various chapters. And Beth, I will advance the slides on your behalf if you wouldn't mind just giving me a next slide. I'll do my best to keep up. Oh, and I just...
Thanks, Sarah. While you're pulling the slides back up, what I'll really quickly say is, just for those that are unfamiliar with our steering committee, is that we have a group of about 19 individuals that represent organizations and state organizations to come together and provide some guidance and leadership for us, the staff team, and for the membership. So that is when we talk about a steering committee. It is led by Melinda Stolley, so she is the chair of our steering committee. And I believe she's on the line today. So hopefully, Melinda, if you hear anything in addition in the discussion that you would like to provide further clarification or thought, please do. But I just wanted everybody to know, when we talk about a steering committee, that's what it is. It's about a 19 individuals on this membership of the steering committee. So at our last meeting, what we did is we walked through a process to really talk through where in each chapter would we take one priority and elevate it for consideration of an action area. So when we talk about our equity chapter, and that being kind of the bookends to the rest of the plan, I think the other thing we need to consider, especially in equity and data, is that it's also going to be throughout the plan. So when we talk about what the chapter of equity and these 3 priorities are, we wanted to highlight specific areas that we needed to call attention to in equity, but you may also see these themes in other areas and chapters of the plan. So for the first priority in our equity chapter, we have increased capacity to reduce the burden of cancer for everyone. Priority 2, we're going to increase the number of Wisconsinites with access to quality health care. And priority 3, increase and prioritize health improvement approaches that engage, center, and benefit populations and communities at highest risk of health-related inequities. Sarah, next slide. So we also wanted to just provide you with a little bit of information supporting this chapter in the measurement area. And as part of our plan, the measurements are all online. So if you want, we have it in our Wisconsin Cancer Plan online version. You can see all of the measurements. So these are the current measurements that we have available online. But as we continue to talk through, you'll see that we are going to, why it is online for our measurement section is that we're always going to be evaluating and learning more about measurements that would be helpful to evaluate how we're doing in chapter number 1. So these are kind of the 3 that we're looking at right now there's 5 of them here. 3 of them related directly to adults and whether they're getting routine care, they have a primary care provider, and if they've reported that they're not getting health care due to cost. So we see that the first two are moving in the right direction, maybe not reaching our goal yet, but at least improving. And we see that the percentage of adults who are foregoing care because of cost is going down. So that is one that we kind of highlighted as an important one to look at. So we also want to look at the percentage of our members on the Wisconsin Cancer Collaborative that are working on healthcare access and the percent of members that are focusing on disparities. So you can see where the numbers are now and knowing that we definitely want to see that increase. So Sarah, next slide. So where did we land through the steering committee selection? Through that discussion, we chose priority 3, which was to increase and prioritize health improvement approaches that engage, center, and benefit populations and communities at highest risk of health-related inequities. So this is where we want to open it up for discussion. If anybody has thoughts, so Sarah, yep, there we go. These are just some prompting questions. So if people are in 100% agreement and say, this is great, I don't have thoughts, or if you want to come off mute and say, I really support this, I want us to consider this. This is some of the areas that we are looking for discussion. So, you know, is this a significant area of need? Does it have a reasonable chance for success? Are we tracking progress and outcomes? And we say we kind of open up the discussion right now because, as Sarah said, at the end of today's conversation, out of the 7 chapters we discuss, we're going to be asking you to just narrow it down to help us narrow it down to 3. So are there any thoughts that people would like to share in the chat or have discussion, or anything any of our steering committee members would like to add? Okay, we must be right on track. That's awesome. We're excited about this new chapter. So I think there was a lot of thought in building the chapter. And I think that's where this priority 3 really resonated with a number of people, if not everybody on the steering committee. So I'm excited that that kind of remains a part of the discussion moving forward. So Sarah, let's move to chapter 2. And this is our risk reduction section. So this is probably the one where we had the most dialogue on where would be the selection of a priority area. So as you can see, or an action area. So you can see our priorities. We have a priority 1 is decrease tobacco use and exposure to tobacco. Priority 2 is increased physical activity and healthy eating. Priority 3 with decrease excessive alcohol consumption. Priority 4, increase cancer prevention vaccine completion. Priority 5, decrease exposure to ultraviolet radiation. And priority 6 of decrease exposure to radon. So next slide in the measurements is going to highlight some of those important areas. So when we were looking and talking through this, we were really looking at the percentage of adults who are at a healthy weight, the percentage of high school students at a healthy weight, high school students that are eating fruits and vegetables, high school students that are being active, adults who binge drink. And I included this one is high school students that have 1 or more drinks in the past 30 days. Now, the green says it's moving in the right direction, but as a parent of a high schooler, I have to say 30% is not a good number. So even though it might be coming down, I really felt like we should probably highlight the fact that that's probably not where we want to be as a state. So, you know, just as you kind of look through these numbers, it'll shed some light on, Sarah, as we move to the next one and we talk through the steering committee selection. So with steering committee selection, looked at increasing physical activity and healthy eating. And through that discussion, we kind of said, when we look at those two, we should probably include alcohol. So to think alcohol would be separate from that, as it plays a role in healthy eating, in weight and obesity, as we can kind of encompass those. So they felt very comfortable in moving forward an action area that would be increasing physical activity and healthy eating and incorporating that decrease of excessive alcohol consumption. So as Sarah mentioned earlier, even though this is going to be a action area suggestion, the other ones on there will not decrease in priority for the Wisconsin Cancer Collaborative. So we will still continue supporting efforts in all of those areas. But when we talked through some of these questions of, is there something we need to work on together? Is there a significant need? Are there other organizations and individuals that we could work on? We really, the steering committee really felt that that priority was one that needed a leader, needed an organization to step up and help to guide the efforts moving forward. So opening it up, if there's any thoughts or discussions for anybody or any steering committee members that wanted to provide thoughts.
This is Sarah. I just wanted to, for the sake of discussion, add that something that's changed in the last 5 years is the funding at the state level for nutrition and physical activity has changed as well. And so due to limited funding in that area as well, the steering committee felt that it was important to include nutrition and physical activity as a priority, which is different from the last time around because of the change. And so I think it's important to recognize that a lot of things can change in just a short amount of time and over, you know, 2, 3, 5 year period. And so that was another reason for us to think about encompassing alcohol as a previous action area or current action area that we have into a broader topic area of nutrition and physical activity, given that changing funding environment.
Thanks, Sarah. I think there's also a lot of increased understanding of the significant role they play in cancer risk. So I'm not sure the general public is aware of those increased risks with physical activity and nutrition and alcohol consumption, and that increased risk that it is causing for cancer. So I think that too was an important place that people felt like we need to continue to elevate that conversation and be a key player in it. So Sarah, let's go on to chapter 3. So chapter 3, early detection and screening. So again, we have 4 priorities in here. We have increasing the risk and demand for cancer screenings, implement healthcare system level strategies to increase recommended cancer screening and diagnostic services, increase access to recommended cancer screenings, and increase utilization of cancer genetic assessment and counseling. So some of the metrics that we looked at when we were discussing this is really looking at screenings. So we looked at the percentage of adults that are up to date on their colorectal screening, on their mammograms, on their Pap test. But the other thing that was important to our group to look at was we took the Wisconsin Collaborative for Healthcare Quality data, which is major healthcare systems from across the state that publicly report their quality measures. So this would be, you know, Aurora and UW and Marshfield. And when they looked at their breast, you know, when we can pull and look at their breast cancer, their cervical cancer, and their colorectal cancer screening rates, we're seeing they're fairly high. You know, when we talk in colorectal cancer screening that the goal is 80%, the Wisconsin Collaborative members are really almost there. And if you round up, they are. So we were like, you know, you look and you think, hey, that's great. Should this be an area? And then we really took that step to look at, but let's look at what's happening with our community clinics and those federally qualified healthcare centers. They're not where the WCHQ data is. So when we look at those large healthcare systems compared to those community clinics, we're seeing a significant difference in the number of individuals that are being screened. So that was important and fairly significant detail for the steering committee as we talked through what did we want to prioritize and what did we feel was going to be important to move forward as an action area suggestion. So next slide, Sarah. So with the steering committee, we really talked about moving forward and suggesting for an action area would be that increase access to recommended cancer screenings. So we really felt like we needed to close the divide and find out how can we not only help individuals get into cancer screenings that maybe just aren't. But we also, this data is before COVID. So this is where the screening rates were in 2019. We know that they are going to change for 2020 and moving forward. So we also had the discussion about how we need to make it a significant point to get people into their cancer screenings. So that's where I think this is two areas on why increase access to recommended cancer screenings. It's not only that we want to make sure that individuals are getting in and have access to get in, but we also know that there are some access issues given our situation with a pandemic. So any thoughts or comments anybody would like to make on our early detection and screening? All right. We can move to chapter 4. So chapter 4 is our treatment chapter. So this is, as you can see, 5 important priorities of increasing availability and access to quality cancer care, increase availability and access to palliative care, early and throughout treatment, increase patient and caregiver access to non-clinical support services. This would include care coordination, patient navigation, psychosocial support, and rehabilitation services. We also want increased participation in clinical trials and increase the number of advanced care planning conversations for all cancer patients early in their treatment. So some of the metrics that we looked at on this was looking at some of our show data. So we looked at the percentage of survivors having other survivors for emotional and social support. We looked at the percentage of survivors having received assistance from a patient navigator and percentage of survivors having received care coordination assistance. So all of these we would really love to see continue to increase and that it maybe wasn't right where we wanted to see it. So these were the data points that we highlighted. So with the treatment chapter, the priority we really highlighted for this one was that increase the patient and caregiver access to non-clinical support services, including care coordination, patient navigation, the psychosocial support, and rehabilitation services. So again, this is just a guide that we're talking about as we kind of start to move forward and think about it as an action area. So when we talk about, this one was fairly straightforward. So any thoughts or discussion or comments to make or questions on this chapter? Okay, we'll keep going on to chapter 5, our survivorship chapter. So this is 3 priorities along the lines of increasing awareness of issues relevant to cancer survivors and caregivers. Number 2, we're going to increase the implementation of best practices for the transition from active treatment to post-treatment care. And priority 3 is increasing the provider, patient, and caregiver awareness of the importance of cancer risk reduction behaviors in cancer screenings for cancer survivors. So some of the metrics that we looked at, again, some of them are from the show data again, but we also looked at the percent receiving a survivorship care plan. We looked at the percent of survivors having discussed follow-up care, percent of survivors having discussed long-term side effects of their treatment, and percent of survivors having discussed lifestyle or health recommendations in detail with a provider. So you can kind of see where we are with our baseline starting out in 2020 and where the target is as we move forward until 2030. So there is some significant improvements we'd like to make in each one of these measures. So with that, when we talk about survivorship, we had a really great conversation around needing to maybe include more than one priority and combine the two because they were similar, but really significant in the care of our cancer survivors and caregivers. So we looked at increased awareness of issues relevant to cancer survivors and caregivers and increasing the implementation of best practices for the transition from active treatment to post-treatment. So we felt like both of those were extremely significant and maybe they should be combined and really looking out for what are the how can we increase issues relevant to cancer survivors and caregivers and make sure that they have the best transition from active treatment to post-treatment care. So that's going to kind of be combined into one action area suggestion moving forward. So I will open it up for discussion. I know we've been a little quiet so far, so just so you know, when we're all done talking, I'm really going to pull out some comments from people because I know there's some thoughts out there. But if you're like me, I like to just sit and listen and take it all in. So I hope that's what everybody's doing. And then when we get to the end, that we can have some dialogue and questions and letting us know what your thoughts are. So any thoughts on survivorship? Okay, let's move to chapter 6, end of life. So end of life has two priorities. It has increased availability and access to palliative medicine during end of life care and increased access to quality end of life care. So the measures that we look at with our end of life chapter is the percentage of adults who know what palliative care is and the average number of days in hospice care per patient among Medicare enrollees. So moving in the right direction, but as you can see with the targets, we still have some growth to do in both of those areas. So when we looked at a priority to move forward for an action area suggestion, we really decided it was important to just combine the two of these, that, you know, end of life care needs to encompass both. It really needs to encompass the availability and access of palliative care medicine because that's part of increasing access to quality end of life care. So we didn't see number one being significantly different than number two. So when we really talk about increasing access to quality end of life care, it really should include that access to palliative medicine. So any thoughts or discussion? This one is fairly straightforward since we chose them both. So any questions? I just always want to make sure if there's any thoughts or questions that we capture those.
This is Sarah. I just wanted to jump in with some commentary as well. I think in the last few years, the American Cancer Society's Cancer Action Network has taken a lead along with the Palliative Care Network of Wisconsin to establish a palliative care advisory council within the state. Currently, that has not been established, but I know a lot of traction has been made in that as well. So I think this is something that our policy agenda will likely be looking at as well. So I just wanted to add that as well.
Thank you, Sarah. That's really an important point, that as we talk through our action areas, there is kind of a parallel process working with our policy committee to identify significant policy issues. All right, how about our last chapter, data? So we have 3 priorities in the data chapter, and that is to promote awareness and use of the Wisconsin Cancer Reporting Systems data. Priority 2 of improve Wisconsin-specific cancer-related data sources, and priority 3 of monitor data related to emerging cancer issues. And because it's a data chapter, there's not measurements. So, and one thing that was significant in our conversation with the steering committee is this number 2, is improving Wisconsin-specific cancer-related data sources. So not that we wouldn't continue to support our partners at the Wisconsin Cancer Reporting System and anything we can do to promote the awareness and use of the data, but we really want to also make sure in all of the previous chapters that we are looking at that Wisconsin-specific cancer-related data sources, because as we walk through each chapter, we really felt like there were other sources maybe out there, or maybe there's places we need to work on capturing the data that we're just not doing it. Because maybe there is, especially as we look at our health equity initiatives and our health equity work, we're maybe not even capturing the data that we need. So we felt really strongly that the improve this cancer-related data sources was going to be a significant piece we wanted to move forward as a suggestion for action areas. So Sarah, why don't we go to the next slide And I would like to open it up for conversation, because now is where we're going to put you all to work. We are going to ask you of the 7 action area suggestions we just provided. So that is Sarah has them up on the screen. So of each chapter, we're putting forward one thought of an action area for each, but we need to narrow it down to 3. So we would love your thoughts. We're going to put up a poll, but this is where I'd like to open it up. If there are thoughts, suggestions, if you think we missed the mark and you say, wow, why didn't you choose? Because that one is so important and it needs an action area priority. So I would love if there are thoughts or comments, and then we will open up the poll and capture everybody's ideas.
This is Nicole with the Wisconsin Well Woman Program. I just wanted to say that I really like the selections that the committee has put forth here for us to choose from. I think they're really relevant and important to what we're seeing happening in Wisconsin related to cancer.
Well, thank you. Thank you for sharing. I really appreciate that, because it's important to us to know that we're really helping select meaningful areas for our members, because this is what we're hoping this process is going to do, is we're going to find these 3 areas where we can dedicate an action planning process where we can help guide bringing in new members, bringing in partners, bringing in resources, and continue to just elevate these priorities in a new way for the next 2 years. So that's exactly what I wanted to hear. Thank you so much, Nicole. I appreciate it, because we want to make sure we're on track. And if we're going to work and build these action areas out with you, our membership, that we're doing it in the right areas. And it's the areas where you feel are most significant and where your priorities are, where your organizational priorities are. So thank you.
Well, and I just want to say too, I looking at this from, as a public health nurse, from a healthcare standpoint, I see where all of these are very relevant to what we're dealing with today, but also from a personal standpoint of having gone through, family members that have been affected by cancer, how there's a lot of points in here that you made on picking these that would have been really, that I would have really liked to have seen more in the care that we experience. So I think that's one of the reasons why I think these are really good focus areas as well too. So.
Great, thank you. Well, I think, Sarah, we should put the poll up. Let's see where we land. So this is, you will have the opportunity to choose 3 via the poll.
And I would like to say that I included the 2 options for survivorship and the 2 options of end of life separate, but there is no limitation to how many you can select. So we asked you to select 3, but if you really feel like, both of the survivorship or both of the end of life, feel free to just select both of those, because those will likely be combined. And I would like to add that we are so grateful for everyone being able to take the time out of, a particularly busy time in public health and healthcare and community. And so thank you so much for taking the time. But we recognize there are a lot of people who are not able to participate, and this is a really big decision that we as a coalition need to make. And so I think there will also be some other opportunities that we will be exploring as a staff and a steering committee to think about ways that we can get feedback from those who were unable to make it. So keep an eye out and feel free to recommend other alternatives too. Likely will be some type of survey, or maybe perhaps some type of survey even during our summit, which we'll be reminding you about shortly as well. We'll go ahead and maybe give it 30 more seconds for people to select. If that's too little time, feel free to say that in the chat or unmute your line. Okay, we'll give it 5, 4, 3, 2, 1. So hopefully here you can all see the results. Clearly equity is a top priority, and I think the steering committee and certainly the staff echo that as well. I think next were those that received 4, screening and early detection, increasing access to recommended cancer screenings, and then treatment, where we have increased patient and caregiver access to non-clinical support services, including care coordination, patient navigation, psychosocial support, and rehabilitation services. And then with a 3-way tie for 3 was the risk reduction of increasing physical activity and healthy eating, and survivorship, increasing the implementation of best practices for the transition from active treatment to post-treatment care that would be buddied up with its other fellow survivorship priority, and then also end of life, increasing access to quality of end of life care. So it seems like there are some natural top selections. I don't know if anyone had any reflections or comments based on the results you're seeing, or if Beth, you'd like to add anything.
No, this is great. And maybe what we'll just say is the next steps in this process. So we'll continue to keep the membership involved, because it is so important to us that these action areas really represent the priorities of our members, and where we really can be most supportive of the work of the state and moving forward those activities that are going to reduce the cancer burden for our state. So just please keep us engaged. If you have thoughts after this that you would like to, feel free to email any of us on the team, and just let us know your thoughts. And if you feel strongly, or if there's an area that you really believe is amazing and you would love to be involved more, just let us know. We'd love to hear that. Thank you, Sarah.
Thank you so much, Beth, and thank you all for your willingness again to join and for your input via the poll. Beth mentioned the next steps as well, and this is roughly the calendar in which we're kind of operating to make these action areas come to life. We don't want that Wisconsin Cancer Plan sitting on the shelf for too long. We want to make sure we're getting it off and taking action as soon as possible. It's as if we have no other competing priorities right now. But in all joking aside, cancer doesn't stop during this time. And so we, I think, all realize that it's quite difficult to have so many competing priorities at once, but cancer does not stop during a pandemic. And so we are, again, grateful for this opportunity to share with all of you and continue moving forward in this work and finding other creative alternatives to carry this work forward. So in November and December, our steering committee and policy committee will be reviewing the membership input in all the conversation that we had today and moving forward. And then in January and February, the staff will begin working with all of you and soliciting members for contributions. Again, this is not going to be something that is staff-led. Certainly there is staff dedicated to help making sure that we are staying on track with our action areas, but we really will rely on the entire membership and partnership and stakeholder group of Wisconsin to see this work forward. And one important way for us all to stay engaged is by joining our all virtual 2020 Wisconsin Cancer Summit. And that will be held in 3-hour increments on October 28th and October 29th. We are really excited to have Dr. Lisa Richardson from the Centers for Disease Control and Prevention talking about leading through uncertainty. She is the CDC's lead on cancer, the cancer branch. And so we're really pleased to have her talk about this framework that we use in our state and how it's applied nationally, and provide some input and inspiration, hopefully, for all of us during this time. Hopefully also ample time to network with each one of you. I don't know about you, but I really miss seeing all of you. And so we're really hoping that this virtual summit will also provide an opportunity for us to network and talk a little bit more and having facilitated discussions. And we'll also be talking about health equity and race and racism, as we realize that, Chapter 1 equity is the first time that we've elevated equity to a chapter level while also integrating it throughout the entire cancer plan. And we want to kick that off in a really meaningful way. And so that conversation and presentation will be facilitated by Ginny Finn of the YWCA Southeast Wisconsin. And we'll have a number of other series of conversations and regional breakout sessions and talking about policy and systems change in healthcare. So all that to say is we would love for you to attend and register for day 1 and day 2. I will say that you have to register for both day 1 and day 2. So if you can only join us for one day, that's just fine, but make sure you'll register for that day to get the corresponding links to be able to join. And all of that is available at our website. Our upcoming monthly networking webinar will actually be a continuation of that health equity and cancer conversation or presentation that occurs at our summit. And it'll be a conversation on equity and cancer facilitated by the YWCA of Southeastern Wisconsin. We are really pleased to have Ginny Finn present. She's the CEO of Southeastern Wisconsin and has a long history of working in cancer, actually, as a former director of ABCD. After breast cancer diagnosis. And we'll also be joined by Dr. Alonzo Walker, formerly retired with the Medical College of Wisconsin, who will be co-facilitating. And I think that's hot off the press. I hope I didn't speak too soon on that, but we're really excited to have both of them. So please join us on November 12th from 10 to 11 a.m. And you can register on our website here on our webinar page. So again, I would like to thank you all for taking the time to join us today and provide your input. Be on the lookout for more opportunities. Feel free to let us know if you have any ideas pop up after this webinar. I know, as Beth mentioned, sometimes you need time to just digest everything that's presented and share feedback at a later time. So thank you now for your input, and thank you for your future input. We really could not do this without all of you. So we hope you have a wonderful day. Enjoy the sunshine while it lasts, and we'll see you soon, hopefully in a few weeks at our all virtual summit. Thank you all.